On my right, I have Mr. Kevin Kassoon sitting in for Colleen Young, Mr. Kim Gartner, and Mr. Barrett Kropf. Today, the committee will be considering two bills, Bill number 18 and Bill number 19. Yes?
Mr. Chair, before we get started with these important bills, I have a motion I would like to move. It's an important motion for this committee to declare that the drug and overdose crisis is an emergency and to task this committee with carrying out an investigation to provide recommendations to the government. I hope we can pass it today. Mr. Chair, I move that in the opinion of the Standing Committee on Human Services, the overdose crisis in Saskatchewan is an urgent public health emergency, and further, that the Standing Committee on Human Services conduct an investigation into the overdose crisis in Saskatchewan, and that the committee provide recommendations to the government on the policies to address the crisis. Is it this one?
You have to look at it. MLA Nippy Albright has moved a motion that, in the opinion of the Standing Committee on Human Services, the overdose crisis in Saskatchewan is an urgent public health emergency, and further that the Standing Committee on Human Services conduct an investigation into the overdose crisis in Saskatchewan, and that the committee provide recommendations to the government on policies to address this crisis. Are committee members ready for the question? Committee members may, sorry. Yep. Do members agree with the motion as read?
Agreed.
The question before the committee is the motion. I would like to inform committee members that I will be exercising my right to a deliberative vote. Those in favor of the motion say aye.
Aye.
Those opposed to the motion, please say no. No. I think the noes have it.
We have a recorded division.
A recorded vote has been called. All those in favor of the motion, please raise your hand. All those opposed to the motion, please raise your hand. Okay, those in favor of the motion 3, those opposed to the motion 4. I declare the motion defeated. Today, the committee will be considering two bills. Bills number 18 and Bill number 19. We'll first consider Bill number 18, the Regulated Health Professions Act. We will begin our consideration with Clause 1.1, short title. Minister Cockrell is here with officials from the ministry. I would ask that officials please state their names before speaking, and please don't touch the microphones. The Hansard operator will turn your microphone on when you are speaking to the committee. Minister, please introduce your officials and make your opening remarks.
Thank you, Mr. Chair. Pleasure to be here today as we discuss the Regulated Health Professions Act. Joining me today to my left is Deputy Minister Tracy Smith. To my right, Tammy Denomi. We also have behind us my colleague, Minister Laurie Carr, as well as Norman O'Neill joining us today. So I'll just start by making some opening comments Regarding this act, and for sake of clarity, I think we can all understand the two acts that we're going to be discussing today are really partnership acts, although I understand that we will be discussing them separately. So please understand that comments made in regards to this first act, very much related to the piece of legislation that we're going to be discussing after this. Governments grant self-regulatory status to professions such as lawyers, physicians, and registered nurses because these professions provide highly skilled services that can potentially harm the public if performed by an incompetent and/or unethical practitioner. In Canada and around the world, there have been substantive changes in how self-regulating professions, particularly health professions, are governed based on the public's growing demand for more accountability and transparency from regulatory bodies. Now, in Saskatchewan today, there is currently a great deal of variation between the 21 individual statutes regulating 28 health professions governed by 26 regulatory bodies. These statutes define the province's existing regulatory framework. Now, the inconsistencies in the current regulatory framework create challenges for regulators to effectively govern their respective members in the public interest. As one of the last Canadian provinces to implement umbrella legislation, this proposal would bring Saskatchewan's regulatory framework of health professions in alignment with what is considered best practice across our country. Consolidating these statutes under a single umbrella act would establish consistent and improved regulatory standards for all health professions regarding registration, governance, complaints, disciplines, public accountabilities, public representation, and bylaw making authority. Greater consistency in these areas would in turn enhance public protection and confidence in both regulatory bodies and the health system as a whole. The development of umbrella legislation will still require the drafting of subordinate regulations specific to each regulated health profession to address the unique features of each profession. This is consistent with the development of umbrella legislation in other provinces. The ministry is continuing to consult with health regulatory bodies regarding the development of the proposed umbrella legislation to ensure that the legislation will provide them with the tools they require to effectively govern in the public interest. Thank you, Mr. Chair.
Thank you, Minister. I'll now open the floor for questions. MLA Mowat.
Thank you, Mr. Chair, and thank you, Mr. Minister, and to the officials who are attending today. I think I have some specific questions around how the bill will be implemented, and questions that have arisen through conversations with regulatory bodies. Many of them likely will not be a surprise to you, but still some outstanding questions around what this whole process looks like and has looked like. Can you speak to, I have some questions around implementation. Can you speak to the estimated timeline for implementation of this project?
Thank you, Ms. Mowat, for the question. We have been, I'd say, signaling and communicating to the sector that we expect this process really to last 2 or 3 years. There's what we are, there's the content of the bill that we're discussing today, but really the meat of this whole movement is going to be in the regulations. Again, we've started consultations on the regulations. generally speaking, but then also about, the restricted activity list as well as profession-specific regulations. Now, again, in parallel to that, at some point, likely at some point next calendar year, we'll start work on the sets of bylaws. Again, still maintain there's 28 separate sets of bylaws that need to be created here for each health profession, and then obviously getting into the standards of practice. And then, once we have everything done, then there's obviously kind of how we apply that within the healthcare system and some work to do, obviously between each profession, the Ministry of Health, the Saskatchewan Health Authority, and other healthcare sector partners. But again, to answer your question, we expect 2 to 3 years for the whole timeline of this.
Thank you, Minister. What have the timelines looked like in other provinces?
So I guess I'll speak to the comparison from provinces that I'm aware of. I believe BC's process took 10 years. Manitoba is still underway, as I understand, in their process. I believe they're into their 5th year. Again, we're hoping, we see some real advantages to how the health system here in Saskatchewan is regulated, we think that us working together with the various stakeholders in the sector, learning from what other provinces have done and maybe their mistakes or maybe kind of how their process was, that's why we remain optimistic with a 2 to 3 year timeline. Again, that will depend once we get into the meat of the consultations too, and ensuring that stakeholders feel heard and and certainly respected, of course, as always, but certainly heard, and making sure that we're moving forward together with the regulations and bylaws that we view, that we can all say are good for the people of Saskatchewan.
You mentioned conversations with other provinces. What have you learned from other provinces who have went through this process already?
perhaps I'll make a couple comments. Certainly we've observed and learned from other provinces that this process takes time. As I indicated in my previous answer, the other piece is really around how important engagement is with the stakeholders in the sector. And I mean, like the first consultation on this bill goes back to 2023. We've been working with the stakeholders, certainly hearing their concerns. My understanding is there was some concerns with earlier drafts of the bill, but again, this is going back and forth with the stakeholders means that we're going to get to a better spot here. I think we've gotten to a good spot here, but certainly I think the process to how we got here, certainly we'll be taking that approach into consulting regarding the regulations and the bylaws. And again, that has been productive, but it takes time to get to a place where everybody can be on the same page. I would just say too, and this would really be, I can't necessarily speak to this, but certainly the 28 regulatory bodies could, all the regulatory bodies are watching what has happened in other provinces and are certainly, again, they know their professions best. So if you're if you're with the College of Pharmacy here in Saskatchewan and you're going to be watching what happened in Manitoba and British Columbia, taking hopefully what's good and leaving what isn't. So certainly I guess I spoke to what we've learned as a ministry from other provinces, but certainly all 28 regulatory bodies are going to be taking lessons from their respective colleagues in other provinces that have gone through the umbrella legislation process.
Has have you folks talked to any of the regulators out of province as well about what their experiences have been like?
So the feedback that we've sought from people outside of the province would really be limited to, number one, obviously the other ministries right across the country that have already gone through this process, but also the national regulatory bodies, say the CRNS for registered nurses. Now, I will say that my understanding is that the feedback that we've received from the national regulatory bodies has been fairly brief, just because, again, these regulatory bodies are national, recognize that the legislative frameworks in provinces are all very different and unique, and I think they respect that. So, but in terms of seeking feedback from other regulatory bodies in other provinces, I mean, we're really looking for something that's going to work here in Saskatchewan, and certainly, again, we would rely on, but I think it's also fair to say that the regulatory bodies in Saskatchewan are, I'm sure, speaking with colleagues in other provinces and understanding what's been done there.
The national bodies that you receive feedback for, did you seek that feedback out, or did they come to you with that feedback?
Yeah, from the national regulatory bodies, that was sought out. So, and again, what we have received back has been fairly brief in nature. So,
which of those bodies have you received feedback from?
So again, we've sought feedback from several national organizations via email. We haven't heard back from all of them, but certainly the associations that have gotten back to us, be the associations representing RTs, dental assistants, OTs, natural health practitioners. So again, the feedback from national bodies has been very limited, and I think it'd be fair to expect, and again, I hate to assume, but certainly it would be, I would imagine that our provincial regulatory bodies are seeking comment from their national regulatory bodies and their national associations as well. So,
Speaking a little bit about comparing our situation to other provinces and how long it's taken some other provinces. I'd also heard that I think Alberta, it took 10 years to do something similar as well, in addition to the examples that you provided. And I've heard that it took much longer than 5 years in Manitoba. People are saying like 20 years to me. Is that not the case?
it's my understanding Manitoba isn't complete yet. It's my understanding Manitoba is not complete yet.
Yeah.
Again, I haven't spoken to the health minister in Manitoba regarding this specific issue, but
Okay.
that's my understanding.
In terms of what makes us the same or different from other provinces, you spoke about being optimistic about a shorter timeline. Do you think it's realistic that there's this short of a timeline?
I think, Ms. Moy, you're correct in saying it's, this I won't quote you. This wasn't your word. It is an ambitious timeline, but I would say, I think what gives us hope on this is, again, the productive back and forth that we've had with stakeholders thus far on it. There's a mutual desire from all parties involved to see this through, and stakeholders and ministry alike, both recognize that there's a need to move in this direction and quickly. We've had, again, and speaking to the productive nature of the discussions thus far. So again, if, and certainly, the ministry is committed to being proactive and collaborative to move this through as quickly as possible. I'll say that the ministry is also adding some legal capacity to our team, and so that will again add to, I guess, the volume of work that we're able to work through, in concert with the Ministry of Justice and obviously the legal counsels from each regulatory body. So certainly, we see an opportunity here. Again, speaking to the constructiveness of the process thus far and the changes that we have been able to make, back and forth with the regulators, if we get to a point, where there's places of disagreement, we're gonna take the time to make sure that we get to a good spot. And because at the end of the day, this piece of legislation is all about representing the public interest in the best way. So certainly, this is the timeline that we're aiming for, but want to make sure that both the ministry and the regulators end up in a good spot.
Thank you. Has a project plan been developed for this project?
So in regards to a project plan, we do have a draft plan that's been developed. Obviously, once we get through the passage of this legislation, hopefully, and the legal capacity being added to the team, that draft plan will be finalized.
Thank you. Who is going to lead this work?
So this project, obviously being led by the ministry and certainly specifically the Partnerships, Privacy and Legislative Services branch of the Ministry of Health. Obviously, there's been, and some of those people are sitting beside me here and joining us. Certainly, I can say that there's been significant work within the ministry, not just in the PPLS branch, but engaging with other branches in the ministry. Some branches interact with the regulatory bodies more frequently, and so again, that's also been, I'd say, a parallel process over the last little while is, this specific branch in the ministry gathering feedback from other parts of the ministry and making sure that what we're hearing and what's being drafted and introduced is representative of where the ministry would like to go.
Thank you. You talked about adding some legal capacity. Can you talk about what human resources are being added to the project in particular?
So, within the ministry, there's a team in this branch that works, exclusively on regulatory issues and engagement with the regulators. When I talked about adding additional staff, so there's already 2 dedicated staff on this project within the ministry. Then we've added 2 term positions specifically for this project around policy and research. The legal capacity that I mentioned earlier and that you asked about specifically, that will be a contract position. My understanding is that we do not have a contract signed as of yet. And don't forget, there's also capacity within the Ministry of Justice with their drafting folks. I can't speak to exactly how the Ministry of Justice is allocating staff resources, but there's my understanding is a couple drafters specifically that are a part of this project. And so working quite closely with them as any ministry would on a piece of legislation and the development of regulations.
Thank you. For the 2 term positions that you mentioned, what are the contract dates of those positions?
So the policy position, that's a 2-year term. And then the research position, it currently on a summer term, and then we'll start a new term come this fall. Certainly, as the project progresses and develops, we'll look at extending those terms as needed as the project necessitates.
For the 2-year policy position, how long has that person been working already?
So the individual filling the policy position, unclear on the exact date, but sometime in January of this year. My understanding, the individual has had quite extensive experience in the health sector, working in the ministry and various other partner agencies as well.
In terms of the workload that's required here, talking about the capacity of the ministry team and the added capacity here, which tasks is the ministry prepared to assist with?
Sorry, Ms. Mona, maybe we didn't quite understand your question, or maybe you want to rephrase it. I mean, in terms of assisting with the ministry is running the project. So, I mean, that's the people I talk about, the 2 dedicated staff already within the branch, the 2 term positions we've added, the contract legal position we'll add, obviously not to mention the work being done by other people in the ministry adjacent to the project. I mean, the ministry, this is a key priority project for the ministry, so this is something that gets reported up through the deputy minister on a regular basis, and then obviously to myself as the minister. So, yeah, perhaps, sorry, maybe I didn't quite understand. Yeah.
I can rephrase my question. Can you walk us through the workload that is required of the regulatory bodies to transition in order to be in compliance with this new legislation?
So the question is really in regards to kind of understanding what's required of the regulatory bodies.
Yep.
Okay, thank you.
That's what it is. I mean, just kidding. I'm sure you're doing something valuable. Literally in the hot seats. That's right. He's watching us. Oh, now I am, but I wasn't before. You said the sound turned down. Right after you did. Especially 16 minutes when it comes to.
I think it might be too early to be very specific around what the workload for each regulator looks like. Certainly, we would request, as we have, to get to this point, we'd be requesting their participation from all of them on the regulations. The heavy lifting will be in the regulations, and then certainly the bylaws. Now, again, we have regulators of various sizes, and so College of Physicians and Surgeons, a well-developed organization, lots of capacity in that organization. A smaller regulatory body, for example, massage therapists, just a smaller organization, right? So, as I said, certainly we expect the heavy lifting to really be around the bylaws, and that's where, the work there for the various regulatory bodies is working with their respective memberships. And obviously there's a whole process within that to collect feedback and engage members that way. As I said, this is a priority project for the ministry, and understanding there's varying capacities within the bodies. We want to be collaborative, as I've said, and be working with the regulatory bodies to move this along. So certainly as we get into the process more, get a better sense of the workload, I think there'd be some opportunities for similar regulatory bodies to work together and perhaps use some of each other's work when it comes to bylaws as one example. So certainly, again, the ministry will be collaborative, and hopefully we see some collaboration between the regulatory bodies as well.
You identify that it's going to look different for different sizes of regulatory bodies. So many different professions, different regulatory bodies do different things and have different responsibilities as well. You're very aware of this. Is there any consideration for tailored approaches to different regulatory bodies, and what might that look like in terms of the support that they're able to receive from the ministry on, we're talking about like hundreds of documents having to be updated, like just so people can get a sense of how big this project is for some of these regulators. Legal oversight being needed in so many different cases, especially with regulators that have been in practice for a long time. Like there's quite a large body of work that's going to be required, and what consideration has been given to providing supports in those circumstances.
Again, in response to your question, I think perhaps it's still maybe early days to give a definitive answer on that. We have We've considered tailored approaches, and I would say that we would be receptive to that, but, you know, again, understanding that we want to be collaborative throughout this process. Again, as we get into meeting with all the regulatory bodies one-on-one, I expect that we'll hear, you know, specific feedback on what a tailored approach for individual regulatory bodies will look like. Certainly, we're open to that. I mean, keeping in mind, you know, we talk about the workload for the regulatory bodies. You know, keep in mind, I mean, all these organizations already have a set of bylaws, right? You know, there's been a good volume of work that have been done by these organizations in the past to get to where they are today. So certainly open to tailored approaches. I think once we get into, again, to those one-on-one consultations, then we'll have an opportunity to hear more and, you know, make a determination on that.
Thanks. I think one of the concerns that I've heard is about the ability of smaller regulators to do a very large volume of work off the side of their desk and not have any of their other duties suffer as a result of that work. And I think the timeline pressures factor into that. I'm sure you've heard the same thing. And I think what folks are looking for is some assurances that there will be some balance on that front. And support provided. And I think there is a question around how much of that work falls on the individual regulators and how much of it falls on the ministry.
Well, you know, I'll just say, as I said in a previous answer, certainly and I've met with several of the regulatory bodies already. There is a variation in size and administrative capacity. Certainly understand that some colleges have thousands of members, some have tens of members. So it's, you know, certainly can appreciate that there's going to be a difference in administrative capacity. I think where we generally are is we've got 28 regulatory bodies, to my understanding, that are all, you know, supportive of moving in this direction. But yeah, certainly questions. Once we get into the drafting of regulations and bylaws, then we'll have a better sense, or once we get closer to that point, we'll have a sense of capacity, and then again, how the ministry can work with those bodies to get to where we need to be at the end of the day for the members, at the end of the day for the public interest. So certain, as I said, I know I perhaps sound like a broken record tonight, but we want to take a collaborative, you know, lens to this. And again, we have a timeline that we think reflects how important we think this piece of legislation is in the following regulations. So, you know, we'll be working ambitiously to work with these 28 groups to get there.
Has the ministry asked regulators to estimate what additional resources they would require to get this work accomplished within that time frame?
So, yes, the regulators were asked about financial implications, but very early in the process. And as I said, generally speaking, the consultations on this piece of legislation go back to 2023. So early in the process, certainly, a range of estimates. As we both understand, large and small regulatory bodies. I think as we get into these more detailed discussions with the regulatory bodies, we'll be able to better flesh out with them, resources required, and that will, inform the individual regulatory bodies and the decisions they make, and also the decisions ministry makes throughout its budget processes each and every year.
Have you been made aware of regulators hiring additional folks to assist them with their work on this project?
So the ministry hasn't heard that to date, that regulators have staffed up or added staff. Certainly that doesn't mean that they haven't, but as far as the ministry is aware, that has not occurred yet.
If regulators have to seek out additional hours of legal advice, I think there are concerns that there's only a small amount of folks who do work in this field that would have the awareness of how to do this, and if everyone's trying to access those folks at the same time, that could add some pressures into timeline for implementation. But in terms of costs, is there an understanding of how much this is expected to cost regulators as you look at those additional resources that will likely be required?
Not an estimate at this time. As I indicated in a previous answer, we received perhaps some high-level back-of-the-napkin type estimates very early in the consultation process, but certainly as we get into further one-on-one consultations, we expect that regulators will be kind of quantifying the work in their own bodies, and and then we'll have a discussion once we have some more details. Hard to kind of work on a resourcing plan without kind of quantifying the scope, right? So, or the required work.
You mentioned contracting one legal individual and also relying on Ministry of Justice with some of the drafting. Can you clearly sort of identify which legal work would be the responsibility of a regulator and which legal work would be the responsibility of the ministry? Certainly, I'm thinking folks that are working for the ministry would not be at the beck and call of the regulators. Where are those lines drawn?
again, I would emphasize, still early days on figuring out some of these boundaries and how that's resourced. Obviously, the legal capacity within the Ministry of Health will prepare the drafting instructions to be sent over to the Ministry of Justice, but informing those drafting instructions will be our consultations with the different regulatory bodies. Certainly, I would expect the regulatory bodies to likely have some internal legal capacity as they engage their members and, provide their comments so that we can get those drafting instructions over to the Ministry of Justice. I would say that there will likely be some utility or value in having that ministry legal capacity directly engaged with perhaps legal counsels from the regulatory bodies, or a board or a smaller subset of, or a committee of members that are focused on this. But that's I guess that's really probably the most I could say at this point around the breakdown of activity there.
What is the anticipated cost to government? Is there a budget for the project?
Too early to say at this point. Again, as I indicated earlier, some initial estimates, but those were very early days, and now that we've moved along a little ways, I expect that we will, as part of next year's budget process, begin to contemplate that and try to provide some more firm numbers for government.
In terms of the project plan, is there we have all these different regulatory bodies. Is there a desire to sort of start tackling them all at the same time? Is there an idea of which ones will be going first? Are there going to be a few at a time? What is that work expected to look like?
So the plan as it stands right now is to have kind of a initial contact with all 28 bodies by the end of June, kind of as a first touch point. Obviously, that first touch point will kind of inform the project plan and kind of where we get into things. I do think there may be an opportunity for similar professions or related professions to work more in concert with each other. I mean, to take, for example, the dental professions, they currently reside under one act. Like, I won't speak for them, but it likely makes sense that there'll be some economies of scale of being able to do engagement with those regulatory bodies together, as well as those regulatory bodies being able to, when we talk about resources required, be able to access, one resource instead of three resources, right? So there's, again, I won't speak for the regulatory bodies today, but certainly as we reach out to all of them before the end of June and have those conversations, we'll get a better sense of that.
A few more general questions here before my time comes to an end. Speaking specifically around the intent of the legislation, I know that when Bill 120 was introduced and passed, there was a great attention toward modernization, some ability for, I think, a little bit more portability within the healthcare professions. What does this legislation do that to modernize and improve the professions that Bill 120 didn't do?
So to my understanding, Bill 120 required each regulatory body to make amendments to their own legislation. Again, what this does is bring everybody together, have some standardization, specifically around, the areas of registration or complaints or governance. And I think to have some consistency, and while we recognize there's regulatory bodies of different sizes, and there's also, I think it's in the public interest to have clear consistency in terms of how does a member of the public, how does the complaint process work with one regulatory body versus the other. I think it makes good sense, for the folks that we represent. If they have a concern with a practitioner, having that consistency across the 28 bodies, I think makes good sense. There's also a piece of this too that as we seek to, again, within the healthcare system, encourage people of different professions to work in more collaborative models. This legislation will help, I think, move us further down that road. I think that's what our constituents are looking for, is different models of care that can give them better access to health care, whatever that may look like in their community, large or small. This, I would say, this piece of legislation helps us move down that road. But really, I think the core of it comes down to protecting the public interest, and part of the way that this legislation does that is provide some standardization and consistency.
Can you speak to the impact on processes that are already underway? I'm thinking of scope expansion projects, scope modernization. My understanding is that changes in scope will have to be put on hold during the transition period, and that there are a lot of questions about how that will work.
So I think it's important to note that this piece of legislation does not expand scope. It optimizes the current scope. I will say that the work that's already underway to expand scope, whether that be on the pharmacy, and we've talked about some of the pilot projects there, both in Swift Current and Weyburn, as well as the point of care testing pilots happening in 50-some communities right around the province, improving access to care for patients in those communities. That work will continue to go on with regulatory bodies, and I think the government has been clear that we will continue to look for opportunities to use scope expansion to improve access to healthcare for people in communities large and small. Certainly when we talk about improving healthcare in rural and northern communities, I think there's some really exciting opportunities ahead for scope expansion. That work will not be put on hold by this work and this project. This is happening in the background. We've talked over the last hour here about the many complexities of the project. But while that work continues on, ministry, regulatory bodies doing heavy lifting, there's also other branches of the ministry and the Saskatchewan Health Authority, and obviously those regulatory bodies and the corresponding professional associations that are all working, I'd say, trying to find opportunities for their members to offer more services. This government's very supportive of that. We'll continue to work with all those stakeholders to expand scope where we can. And again, at the end of the day, it's about the patient, and we see some opportunity there.
It's really good to hear. Thank you. In terms of the decision to use the restricted activities schedule, I wonder if you can speak to why this model was chosen, what other jurisdictions use it, and provide a bit of an explanation of what the plan is for this.
So really the restricted activities model is, again, going back to ensuring optimizing the current scope for all regulatory bodies. The legislation that we've seen in other provinces has something very similar to this, maybe just different names in different provinces. But, you know, this is a model I think that we can optimize existing scope, again, while protecting the public. So that's why we've chosen to go down this path. And as I said earlier, this will be one of the places of heavy lifting for the ministry and the regulatory bodies.
Can you speak to how changes to restricted activities will be addressed? I'm thinking about, you know, changes in technology, which sometimes happen quite quickly. You know, will there be flexibility within this model to address that? And then if there are disputes between professions, who's the arbiter of restricted activities? What does that process look like?
Yeah, Ms. Moe, you raise a very good point on being responsive to advancements in technology. You know, again, certainly the consideration of that and how that works would be in the regulations, and I think that does obviously it being in regulations that uncouples it a little bit from the legislative calendar, if you will, or the typical legislative process. So I think that does provide some sufficient clarity for, or some sufficient flexibility, pardon me, for the ministry to adjust. I think, though, that this is where, you know, when issues come up down the road regarding technology or disputes, you know, we'd seek to have a collaborative approach with the regulatory bodies. I mean, if there's technological advancements, certainly I think you could expect that the ministry would work with any affected regulatory body on finding a good spot where practitioners can feel like their profession is protected while still, ensuring that patients have access and can be protected as that technology is used. That would be my hope. In regards to being the arbiter of disputes, this legislation does give the minister bylaw making authority, and certainly, while that is significant, again, I would say that we would want to be working with the regulatory bodies to find a collaborative way to sort through issues. When I look at that list of affected regulatory bodies, all of those professions have important roles to play in the healthcare journey of us as individuals in the province. So I think this, while we're seeking standardization and consistency, disagreements are sure to arise down the road. The minister will have bylaw making authority under this legislation, but finding a collaborative approach would be our desired outcome.
I have a couple more questions. I want to ask about the situation that massage therapists are in. So their bill was passed in 2021, but hasn't been brought into force. And so it hasn't been proclaimed. And so I understand that with this legislation, it would repeal the Massage Therapy Act, which has not yet been proclaimed. Like, will that act be proclaimed first? And what does that look like for them, I guess?
Yeah, with respect to massage therapists, Bill 3 has received royal assent. It's just not in force, as you mentioned. That bill will need to be repealed as a part of this process.
So when
And that's sorry, I should just say that that's not unlike the other 25 pieces of legislation that will have to be repealed.
So just in terms of, like, if they don't have a college yet, if and when this bill is proclaimed, does that create a college for them? Or are we then having to proclaim legislation that is just going to immediately be repealed? I just don't understand what comes next under this circumstance. It seems a little complicated.
Order of operations question more than anything. Is that what I'm getting? Again, with respect to the massage therapists, the intent would be to roll the work that has been already done into this process, and then obviously once this legislation is proclaimed, then that would establish them as a college, and with the bylaws and regulations. And again, certainly, that you identified a unique situation on the list, and so again, perhaps when we talk about all the talk about collaboration, no more necessary than in that specific case, just to make sure that we get it right as part of this legislation.
Thank you. In terms of that bill not being proclaimed for so long, I'm just wondering now when we expect this bill to come into force, or if we expect that there will be a similar process of waiting. I just feel like there was a lot of excitement and momentum about the passing of that bill, and then it kind of just deflated as it became a cumbersome sort of work project to get all of these things in place before the proclamation. When do you expect that this bill will come into force, assuming it gets through all the stages here this spring in the next couple weeks?
It will take likely a minimum of 3 years, 2 or 3 years to get to that point. Again, we have to get through all the development of the regulations and the bylaws before we get to that point. And again, certainly recognize that massage therapists do play a crucial role in the system and represent an important mode of care for many people in the province. And the timing is perhaps not intentional. It's just this is here is the opportunity to bring everybody together, standardize it in the name of public interest. So certainly we don't expect this bill to come into force, obviously, until all the regulations and bylaws are in place across all regulatory bodies, including the massage therapists in this case.
So I suppose a quick follow-up then. So is there an expectation that the Massage Therapy Act will be proclaimed in the meantime?
So the ministry will be meeting with the College of Massage Therapists later this month, having discussions with them about obviously this piece of legislation, but also I would expect Bill 3 to come up as part of that conversation. If everything is in order from a regulations and bylaws perspective, then I wouldn't see a reason at this point not to proclaim that, but obviously we have to make sure that that's in place in the meantime. But I think, again, certainly we would look to that meeting and that our engagement with them to get some specific feedback and see where they're at, and certainly where their members are at in regards to that.
Thank you. I have no further questions, Mr. Chair.
Okay, are there any more questions or comments from any committee members? Seeing none, we will proceed to vote on the clauses. Minister Cockrell, you and your officials, if you want to spread your wings a little and stretch your legs, this may take us a little while. This bill has 183 clauses. If the committee's in agreement, we can review it by parts and division. That'll save me asking you a question 143 times. So seeing no objection to that, that's how we will proceed. Part 1, Preliminary Matters, Clause 1.1, short title, is that agreed? Carried. Clause 1.2, is that agreed? Carried. Part 2, Governance, Division 1, Designation, Clause 2.1, is that agreed? Division 2, College, Clause 2 to 2.4, is that agreed? I should be saying carried after each time, so carried, 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 carried. Division 3 Council, clauses 2.5 to 2.9. Are they agreed? Carried. Division 4 committees, clause 210, is that agreed? Carried. Division 5 officers and registrar, clause 211, is that agreed? Carried. Part 3 college bylaws, clauses 3.1 to 3.6, are they agreed? Carried. Part 4, registration and licensing of registrants, Division 1 registries, clause 4.1 and 4.2, are they agreed? Carried. Division 2, registration and licensing, clauses 4.3 to 4.5, are they agreed? Carried. Division 3, Public Health Emergency, Clause 4.6, is that agreed? Carried. Part 5, Health Professional Corporations and Other Practice Arrangements, Clauses 5.1 to 5.7, are they agreed? Carried. Part 6, Professional Conduct and Discipline, Division 1, Preliminary Matters, Clauses 6.1 to 6.5. Are they agreed? Carried. Division 2, Professional Conduct Committee, Clauses 6.6 to 6.14. Are they agreed? Carried. Division 3, Discipline Committee, Clauses 6.15 to 6.21. Are they agreed? Carried. Division 4, Additional Committee Matters, Clause 6.22 and 6.23. Agreed? Carried. Division 5, Appeal from the Discipline Committee. Clauses 6.24 to 6.28. Are they agreed? Carried. Division 6, Reinstatement and Other Matters, Clauses 6.29 to 6.33. Are they agreed? Carried. Part 7, Other Duties and Responsibilities of Colleges, Clauses 7.1 to 7.5. Are they agreed? Carried. Part 8, Amalgamation of Colleges, Clauses 8.1 to 8.16. Are they agreed? Carried. Part 9, General, clauses 9.1 to 9.12, are they agreed? Carried. Part 10, regulations, clause 10.1, is that agreed? Carried. Part 11, restricted activities, clauses 11.1 to 11.3, are they agreed? Carried. Part 12, transitional matters, clauses 12.1 to 12.5, are they agreed? Carried. Part 13, repeals and consequential amendments, Division 1, the Chiropractic Act 1994, clauses 13.1 to 13.4, are they agreed? Carried. Division 2, the Dental Disciplines Act, clauses 13.5 to 13.10, are they agreed? Carried. Division 3, the Licensed Practical Nurses Act 2000, clauses 13.11 to 13.12, are they agreed? Carried. Division 4, the Medical Profession Act 1981, clauses 13.13 to 13.20, are they agreed? Carried. Division 5, the Medical Radiation and Imaging Professionals Act, clauses 13.21 and 13.22, are they agreed? Carried. Division 6, the Midwifery Act, clauses 13.23 to 13.25, are they agreed? Carried. Division 7, the Naturopathic Medicine Act and the Naturopathy Act, clauses 13.26 to 13.28, are they agreed? Carried. Division 8, the Optometry Act 1985, clauses 13.29 to 13.33, are they agreed? Carried. Division 9, the Paramedic Act, clause 1332 and 1333. Agreed? Carried. Division 10, the Pharmacy and Pharmacy Disciplines Act, clauses 1334 to 1339. Are they agreed? Carried. Division 11, the Psychologists Act 1997, clauses 1340 to 1346. Are they agreed? Carried. Division 12, the Registered Nurses Act 1988, clauses 1347 to 1357. Are they agreed? Carried. The Division 13, the Registered Psychiatric Nurses Act, clauses 1358 to 1364. Are they agreed? Carried. Division 14, the Speech Language Pathologists and Audiologists Act, clauses 1365 and 1366. Are they agreed? Carried. Division 15, other repeals, clauses 1367 to 1374. Are they agreed? Carried. Part 14, coming into force, clause 14 1 coming into force. Is that agreed? Carried. His Majesty, by and with the advice and consent of the Legislative Assembly of Saskatchewan, enacts as follows: the Regulated Health Professionals Act. Excuse me. I would ask a member to move that we report Bill number 18, the Regulated Health Professions Act, without amendment.
I so move.
MLA Gartner moves. Is that agreed? Carried. MLA Mowat, any closing comments?
Just want to thank the minister and all the officials, or ministers and officials, for spending some time here with us today and shedding some clarity on the process. And please extend our thanks to everyone who's doing work on this. It's quite the undertaking. Just appreciate everyone's time tonight. Thank you.
Minister, any closing comments?
Mr. Chair, just thank you and all committee members for the discussion here tonight and all the support services for making these committee evenings happen. Happy to share some details here, and obviously, as we talked about, this is a project of significant size for the healthcare sector that is just kind of starting to get underway, but at the end of the day, when we think about how this can positively impact patients in Saskatchewan, certainly is something that we're hopeful for, that we all see as patients benefit from. So thank you to the committee.
Thank you. We will now move on to consideration of Bill number 19, the Regulated Health Professions Consequential Amendment Act 2025, a bilingual bill. We'll begin with consideration of Clause 1, short title. Minister Cockrell, you mentioned previously your opening comments from the last bill would apply, but if you have anything further to add, we'll turn the floor over to you.
No comments to add for me.
Okay. Thank you, Minister. Any questions from any MLAs? Seeing none, we'll proceed to vote on the clauses. Clause 1, short title, is that agreed? Carried. Clause 2, is that agreed? Carried. Clause 3, is that agreed? Carried. Clause 4 coming into force, is that agreed? Carried. His Majesty, by and with the advice and consent of the Legislative Assembly of Saskatchewan, enacts as follows: the Regulated Health Professions Consequential Amendments Act 2025, a bilingual bill. I would ask a member to move that we report Bill number 19, the Regulated Health Professions Consequential Amendments Act 2025, without amendment. MLA Kassoon moves. Is that agreed? Carried. Minister, any closing comments?
No, thank you very much.
Thank you. Seeing no other closing comments, that concludes our business for today. I would ask a member to move a motion of adjournment. MLA Kropf has moved. All agreed. The committee stands adjourned to the call of the chair.